In clinical research, we're always chasing certainty. But what happens when the data we rely on is, well, messy? What if it just doesn't fit into our neat statistical models? In this explainer, we're going to unlock a powerful toolkit that's designed for the data you actually get, not just the data you wish you had.
So this really gets at a fundamental challenge in medical science. See, most of the statistical tests we learn about first, they assume our data fits a perfect symmetrical bell curve. But let's be real, in clinical practice, data from patients is rarely that simple. It's often messy, a little skewed, and full of surprises.
And this visual just nails the problem. Over on the left, you've got the ideal world, that perfect symmetrical distribution where everything, the mean, the median, the mode, all lines up beautifully. But on the right, that's what we so often see in reality, an asymmetrical or skewed distribution. And you can see how just a few extreme values, what we call outliers, can literally pull the average, the mean, away from the center. That can give you a really misleading picture of what's typical for a patient. This brings us to a really core idea. This whole assumption of a perfect normal distribution is a lot of the time a myth in healthcare. Things like patient recovery times or pain scores, they don't always follow that neat bell curve. So if our data doesn't fit the rules for our standard tools, we could end up drawing the completely wrong conclusions. We absolutely need a different approach. And that, right there, is where non-parametric tests come in. A good way to think about this is that you have two different statistical toolkits. The parametric toolkit is super powerful, for sure, but it's built for that ideal bell-shaped data. The non-parametric toolkit, on the other hand, is what we grab when we're dealing with that complex, real-world data we just talked about. The best part? It's distribution-free, which is just a fancy way of saying it doesn't care what shape your data is in. And this chart just illustrates the key differences brilliantly. Just look at that row for the central metric. Parametric tests zero in on the mean, which we just saw is super sensitive to outliers. But non-parametric tests, they focus on the median, the actual middle value, which isn't really affected by a few extreme scores. This makes them incredibly tough and, frankly, a much safer choice when you've got a messy dataset. So you can see that the real art and science of good research is knowing which toolkit to open for the job you're doing. And this isn't just some academic exercise either. Using a parametric test when your data breaks its rules can lead to conclusions that are completely invalid. It is absolutely crucial to know when to choose which approach. So the key is to recognize these signs in your data. If your data's skewed, if you've got some major outliers that you know are real values, if your data's ordinal or ranked, it has a clear order but not necessarily equal spacing, kind of like a pain scale from 1 to 10, or even if you're just working with a really small sample size, these are all red flags. They are your cue to put down the parametric tools and pick up the non-parametric ones. All right, so let's crack open that non-parametric toolkit. We're going to take a quick look at 4 essential tools that every clinician and researcher really should know. They cover some of the most common situations you're going to run into. First up, the chi-square test. This is your go-to when you're working with categorical data, so things that can be sorted into distinct groups. It helps you figure out if there's a real statistically significant relationship between two of these variables, or if the pattern you think you see is just due to random chance. Like, is there a real link between smoking status, smoker versus non-smoker, and having a certain disease? The chi-square can tell you. Next, we have the Mann-Whitney U test. The easiest way to think about this one is as the non-parametric version of the independent t-test. You'll use it when you want to compare two completely separate groups, say a treatment group and a control group, but your outcome data isn't normally distributed. It's perfect for things like subjective pain scores or patient satisfaction ratings, where you're comparing the medians, not the means. Now, for those before and after studies, you're going to want the Wilcoxon signed rank test. This is for paired data, where you're measuring the same subjects twice, like before and after they get a new drug. If the change in their measurements is skewed, this test lets you see if that change is statistically significant by looking at the ranks of those differences. Pretty cool, huh? And finally, we've got the Spearman correlation. This is an awesome tool for measuring the relationship between two variables when the data is ranked, or maybe when the relationship just isn't a neat straight line. It looks at the ranks of the data, not the raw values themselves, which makes it perfect for finding connections in things like survey scales or when outliers might be messing up a traditional correlation. So why do we care so much about all this, about choosing the right test? Well, because our statistical choices have real-world consequences. An analysis that's based on the wrong assumptions can lead to totally flawed conclusions, which can then directly impact clinical decisions and ultimately patient care. This is such a critical point to get. A p-value might tell you a result is statistically significant, but that doesn't automatically mean it's important in the real world. Using the correct, robust test helps make sure that the effect you're seeing is real and not just some math quirk that popped up because you used the wrong tool. It helps you bridge that gap to find true clinical significance. Okay, so let's wrap this up with the big takeaways. First, just accept it. Real-world medical data is often messy. Second, remember that non-parametric tests are your flexible, robust toolkit for this messy reality. Third, learn to spot those signs, skew, outliers, ranked data that tell you exactly when to use them. And finally, never forget that choosing the right test is a cornerstone of good, evidence-based medicine.
Ultimately, this all boils down to one question. Every single data set you work with contains a story about patient health, about a disease, or about the effect of a treatment. Honoring that story means choosing the right analytical tools to read it accurately. So, are you equipped to listen to what your data is truly trying to tell you?